It's an honor to be a surgeon, to meet someone in their darkest moment and help them. This is also an honor. It's an honor to bring light to the challenges that Americans are facing in healthcare. And I'm determined. United picked a fight with the wrong lady.
Plastic surgeon Dr. Elizabeth Potter is on a mission to pull back the curtain on the U.S. health insurance industry, no matter the cost.
We've behaved too predictably for a long time. And the fact that it's not normal for doctors and patients to get on social media and talk about the difficulties of healthcare says a lot. We need to start speaking out so that 100 doctors like me or 1,000 doctors like me saying enough is enough.
As a microsurgeon in Texas, Dr. Potter specializes in reconstructive surgery for breast cancer patients, which includes something called the DIEP flap procedure. It involves using a patient's own tissue to rebuild breasts after a mastectomy.
I take care of about 40% of the women in Central Texas with breast cancer. I'm one of the highest volume microsurgeons in the country doing natural tissue reconstruction, and I'm a safety net for women around the country, especially across the South, where they can't find surgeons like me who will do surgeries through insurance.
She built her Austin-based practice, Redbud Surgery Center, to make care more accessible and affordable for patients. Dr. Potter says having her own clinic also helps her bottom line, so she can continue to perform these sophisticated types of surgeries.
Many women who are diagnosed with breast cancer and seek breast reconstruction they go to see a cosmetic plastic surgeon who might only take cash or only does an implant type of reconstruction. They also might find their way to a microsurgeon, but many of them are only out of network, meaning the patients will pay a penalty to go see them, or they actually charge cash.
Dr. Potter says breast reconstruction could cost a patient anywhere from $60,000 to $200,000 out of pocket.
It's simply because insurance doesn't pay well for it. So I set out to prove a different case. I set out to build a practice where I do accept insurance, where I don't penalize the patient for the system that we're in, right? So I accept insurance and I do cases for free.
Now she's raising money to, quote, keep the lights on at her surgery clinic. She says the problem is that United Healthcare, Texas's second largest insurer, isn't accepting Redbud into its network. That makes it hard for her to run a profitable practice, and even harder for patients to afford reconstructive surgery.
If that patient finds their way to my door and there is a legal way to do it, I will do their surgery. And I take a financial hit for that.
When HuffPost reached out to United Healthcare for comment, the company said there was already sufficient access to ambulatory and plastic surgery centers for its members in Travis County, even without Redbud. The company told Dr. Potter that it wasn't accepting any new ambulatory surgery centers into its network back in October 2024. But Dr. Potter claims she's the only physician in the county performing DIEP flap surgery outside of a hospital setting, where procedures are generally more expensive.
I'm going to invest my own money in building a surgery center so that this practice that I do, this work that is so solid and so necessary for so many thousands of women around the country, is based in something stronger. The foundation is deeper and can't be knocked over. That was the passion behind the surgery center.
Dr. Potter believes United Healthcare's actions are retaliation for her public criticism, though the company denies that claim. In January 2025, Dr. Potter went viral for this video she posted to social media.
It's 2025 and insurance just keeps getting worse. I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery. And I need to go back and be with my patient now.
United Healthcare demanded the video be taken down and threatened legal action for defamation. United Healthcare says the call was not urgent and happened because of an error made by the hospital where the surgery was being performed. Dr. Potter says she chose to take the call to advocate for her patient, who was in the care of a co-surgeon while she was on the phone.
I had already had this very deep lived experience with United Healthcare where they were telling me what surgeries I could do and how much they were going to pay for it. I have patients all the time who get bills that are huge and have to live through, the back and forth with insurance companies or hospitals in the midst of the financial devastation of a cancer diagnosis. It was not a long leap to think they may try to not pay for this, and they may put this woman through even more harm. This woman on the table having mastectomies today, they may put her through even more. And if I can take this call, if they're asking, let me take the call, and I can do that right now, and let's see if we can sort it out.
Despite the difficulties navigating insurance, Dr. Potter says she's more motivated than ever to advocate for her patients.
This shouldn't be. Doctors shouldn't have to bear all of this. It's not right. It's not right. And it's not good for patients.
She continues to share her experiences, including peer-to-peer calls with United Healthcare representatives that are part of the appeal process if a service has been denied by an insurer.
The idea behind it is that they have a member that they want to help, and I have a patient that I want to help, and the peer-to-peer is like a way to get on the same page. Let me give you some more information because I think this is the right thing to do for our patient or your member. But that's not what it's like. It's like they're just checking a box. You won't give me your name or number, and neither will the doctor from Texas. How do I know who you are? How do I know that you're board certified and that you're a microsurgeon? Have you performed it yourself for patients with lymphedema? Have you performed it yourself? So have you been the primary surgeon in evaluating and performing lymphovenous bypass for a patient? Even one. You have not. Okay.
Dr. Potter says that she hopes her posts can help challenge insurance companies and hold them accountable.
And I think that there's a really healthy thing happening now as part of this conversation, which is that patients and providers are on the same side. We need to be honest about, the harm that's being done by the financialization of medicine and share that with our patients so that we can all fight and push together. We're always going to have this back and forth between business and medicine. We need a different point of equilibrium. This has shifted far too far towards profit. We need to shift back towards taking care of human beings.
Since the dispute with United Healthcare began, Dr. Potter says Redbud has been accepted in-network by other insurers, including Aetna and Humana. She's also heard from patients and physicians alike who are cheering her on.
The response has been so powerful, and it's one of the reasons why I'm still here, right? It's scary and it's hard to do what I'm doing, but every day, multiple times a day, another doctor reaches out and says thank you. Another retired doctor who left medicine because it was killing them morally reaches out and says, please keep fighting. Another patient who is encountering difficulties getting the care that they need reaches out and says, I haven't seen someone fight like this or tell the truth before.